Hi, everyone, and welcome to the second series in the ICAT Webinar series. Today, we will be focusing on developing research questions, and we are joined by our wonderful panelists, Jenny Sorensen from Human Trafficking Research Initiative at IPA, and Lorenzo and Lorraine, who I'm sure you all know, from ILO and IOM. Before I hand it over to our excellent speakers, a few words about ICAT and the webinar series for those of you who are joining for the first time. As many of you know, ICAT stands for the Interagency Coordination Group Against Trafficking in Persons. It is a United Nations mandated policy forum for coordination and cooperation on preventing and combating trafficking in persons. The group operates under the continuous overall support of the UN Office on Drugs and Crime. ICAT has an overall plan of action focusing on 6 priority areas, one of which is building an evidence base on trafficking in persons. The group's annual activities under the plan of action, however, are shaped by its chairs, which are elected on an annual basis. This year's co-chairs are the International Organization for Migration and the Office of the Special Representative of the Secretary General on Violence Against Children. As part of their co-working plan for 2023, they're focusing, among other things, on promoting data innovations and providing thematic guidance on research on trafficking in persons. This webinar series aims to do just that. 6 webinars are planned in the series, running through November 2023. The first one has already taken place in June. The webinar topics range from trafficking in persons data collection tools and data visualization to trafficking persons research gaps and dilemmas. Each webinar is approximately 45 minutes to 1 hour and features short presentations of examples of current work on these topics, followed by Q&A and discussion. All materials related to the presentations, along with the webinar recordings, will be uploaded to KNOTS, which is UNODC's Center on Human Trafficking and Migrant Smuggling, the platform hosting the webinars. If you opted out of this during registration, you will be able to access the webinar recordings on the ICAT website. And now I'll go ahead and I'll introduce our speakers. First, we have Lorenzo from the International Labor Organization and Lorraine from the International Organization for Migration and ILO. They work within the Research to Action project that is supported by the U.S. Department of Labor. The RTA project aims at accelerating the use of rigorous research by policymakers and practitioners in support of efforts to tackle child labor, forced labor, and human trafficking agendas around the world. Over to you, Lorenzo and Lorraine, to present the global and national research agendas.
Thank you so much for the nice introduction, and welcome to everyone. What we are going to talk today is about the steps or the process we took in developing an evidence gap map on human trafficking that was part of a larger exercise of developing a global and national research agenda. To give you an idea of what this process was, divided first of all in 3 steps. During the first steps, we were taking stock of the existing research or existing data and existing policies. In the second step, we identified the research priority through a set of surveys, online surveys, and key informant interview conducted with funding partners, policymakers, and researchers. We also took advantage of an international advisory board composed by experts from the academia, from the international organization, donors community, policymaker, etc. So it was more really a consultative process to get to the step 3, that was the development of a research agenda in this participatory workshop. What to say is important in the second step, once we took stock of the existing research and information, and thanks to the advisory board, we built what is called the factors and outcomes that define an evidence gap map. And these help us, we will go there in a minute, which were these outcomes and factors, to inform us the research agenda process. They started first with the child labor, then with forced labor. Now we are in the process of discussing together with IPA whether to do together and or to join this research agenda with the learning agenda that IPA used to produce. And the consultation workshop took place in 2022 in between January and October, starting with the global and continuing with other 5 countries. But let's go to what is the main theme of today, the human trafficking evidence gap map. And for this, I will leave the floor to Lorraine.
Thank you, Lorenzo. And on the human trafficking evidence gap map, I just wanted to also say that we have been working with the International Organization for Migration Protection Division very closely to develop this. This is still something that is work in progress, but we're planning to launch this by the end of July, so stay tuned. And in the meantime, let me introduce you the key findings. So there are a few things that we find based on a literature review where we actually index a lot of papers that is related to human trafficking. They can be peer-reviewed papers or reports. One of the first finding is that when we code it by, or we map it by factors and outcomes associated with human trafficking, the studies that were published between 2010 and 2022 highlight the socio-economic conditions and migration pathways of victims and survivors of trafficking. And most of the studies, they assess the linkages between the vulnerability factors and the means like violence and fraud, and purpose like sexual exploitation and child sexual exploitation of trafficking. When it comes to counter-trafficking efforts, like obviously we want to understand what works and what not, we find out that in counter-trafficking programs, empowerment training and awareness raising, they're very much emphasized. While there's a lack of papers that is on awareness raising, and also there's a need to provide appropriate training for stakeholders, including first responders. And third, we find that there's a limited focus on interventions. There's not a lot of studies that talk about interventions and impact evaluations, and there's a need for data collection, improved evaluations, and long-term assessments. We also look into the barriers to effective interventions, and we find that the top barriers to effective responses are first responders' false perceptions of victims and inconsistencies in the operational interpretation of trafficking. And we also find that crisis and corruption are the top barriers to identification of victims and survivors of trafficking. And finally, we also had a look at the geographic focus of these papers in terms of evidence that we know to date. And we find that most studies, they examine trafficking at the global and transnational levels in the global north, and not a lot of studies from the global south.
And going through all these studies, together with the advisory board, we identified 5 broad thematic areas from which a set of research questions would follow to help academia, researcher, practitioner to produce more information that would be needed for evidence-based policy making. These 5 areas include the risk factor for vulnerability, assessment of what works and what not, which is for policy formulation is incredibly important to know, technology and artificial intelligence and the use of this system, especially for data collection, monitoring and measurement, and there also the artificial intelligence can help. Finally, looking at the economic, environmental, and social cost. As I said, we also developed few research questions just to give an idea of what is really missing and what type of gaps we identified during this journey. Lorraine, please.
Yes, and we thought about, based on the themes and the sub-themes, that's basically the bolded words in the trafficking-related research questions. There are some questions that are very important to bridge between research and policy actions. So when it comes to risk factors, one thing is that we can better understand what is the relationship between perpetrators and those they trafficked. And also, what role does gender identities play in vulnerability to trafficking? And to better understand what works and what does not, we can see what is the effect of awareness-raising campaigns and policy action, or maybe how effective are law enforcement services in reducing trafficking. And on the component of technology and artificial intelligence, perhaps we should try to understand in what way is technology being used to facilitate and to prevent or respond to trafficking. And when it comes to monitor and measure, We should try to understand what is the prevalence and also the spatial distribution, like the source, destination, and routes of trafficking. And also when it comes to the social economic cost and environmental cost that is related to research, to policy action, it would be important for us to understand how does climate change influence the risk of trafficking, or for example, how can the private sector strengthen its action and accountability to combat trafficking in global supply chains. And all that is also to say that it requires studies that is of a broad geographic focus, including the global north and the global south. And also it requires researchers from different disciplines, because these are not research questions that can only be addressed by quantitative and or qualitative researchers. It requires collaboration between across disciplines.
And Lorraine was anticipating what we used to do also when developing a research agenda, but also through the process of talking with donors, with funding partners, policy actors, and researchers, is this global and national call to action. Call to action and the call especially to collaborate, as Lorraine said, we will need different disciplines to have an interdisciplinary approach to produce the research, to consult and include in the research process the government since the beginning, to innovate, because the use of the new technology can help a lot in conducting the research and in better understanding which is the situation of human trafficking at country level, but also around the world. And we need to accelerate. We know that things are moving, but not so fast. There are the SDG goals approaching, and there is still lots of things to do. So really, this is a call to maybe accelerating by collaborating, which will help a lot. And Lorraine, to conclude.
Yeah, so finally, this is our last slide. If you have any questions, you can go to these links. And I also wanted to mention that we have all of our materials available in different languages. So for example, the child labor and forced labor evidence gap map, as well as the research agendas at the global level, as well as the national level. We invite you to check out our website. Thank you very much.
Thank you.
Thank you. Thank you both. And sorry, I forgot to introduce myself before. I'm Casey Risco, and I am a program advisor on the Program to End Modern Slavery at the State Department. So apologize for that. So next we have Jenny Sorensen from the Innovations for Poverty Action. She is the director of the Human Trafficking Research Initiative that is supported by the U.S. Department of State. The Human Trafficking Research Initiative, or HTRI, seeks to expand the evidence on primary drivers of human trafficking and the most effective ways to prevent this pervasive problem. Over to you, Jenny, to present the research and learning agenda.
Thanks, Casey. I really appreciate the opportunity to talk with you today. As Casey mentioned, I lead the Human Trafficking Research Initiative at Innovations for Poverty Action. Our mandate, well, we started in 2020. We are funded by the U.S. State Department's Program to End Modern Slavery. And our mandate is to produce rigorous evidence around human trafficking interventions. And we've been kind of involved in this space for about 20 years. Innovations for Poverty Action, in case you don't know the organization, the main focus of this organization is the development and implementation of impact evaluations, also called randomized control trials. So using these kinds of experimental research methods to study humanitarian and development interventions. So we do this because we feel that to measure the impact of programs, we really need to look at what happened with the program and then what would have happened in the absence of the program. So our kind of research model uses treatment and comparison or control groups. And in that way, we can look at what is a credible and reliable way to examine what works and what doesn't work. And then, make sure that the change in the world that we are setting out to do is actually happening. At this time, there are only about, as far as we've been able to find, about 15 randomized control trials that are specifically focused on human trafficking. And that probably sounds like a small number, and it's especially small if you look at the number of studies that are registered in the American Economic Association registry is 7,000. So 15 compared to 7,000 is, pretty small. So we have a long way to go. But part of the mandate of HTRI is to actually help to fund some of those future programs, future research programs. So we have a competitive research fund that has about $3 million, and we're providing early stage research money, and then actually partial or full funding for randomized control trials. And again, that's all focused specifically on human trafficking. And to help guide us in that effort, to help us prioritize what is the kind of research that we want to be funding and what kind of research do we need in the field. Again, it's pretty wide open at this time, but we do want to focus on what kind of research do we think RCTs would be best placed to answer, specific kinds of research questions. So we went through an exercise of speaking to about 100 different stakeholders in government and academics, people with lived experience of human trafficking, to ask what their priority needs and questions were. We looked at what research exists already, because while there aren't that many experimental research studies that are published right now, there is a rich body of qualitative research that's out there. So we looked through that, and then we developed our priority learning questions, which I'll talk about in a minute. And we also provided some guidelines on ethical research practices, specifically, again, kind of focused on the RCT model. And just to say, this research and learning agenda is a living document, so I'll provide a link a little bit later on to the document on our website. And we are updating it once or twice a year just to be able to make sure that we're incorporating all of the new research coming out, because this is all in process. So here are our 5 priority learning questions. If you're familiar with the US State Department's annual report, you'll see that this follows kind of the 3P, 4P model. So prevention, protection, prosecution, and partnership. I'll go into each of these in a little bit more detail next, but I just wanted to mention that each of these questions in our research and learning agenda, we do have sub-questions. We discuss the state of the evidence and whatever program or knowledge gaps we see for each kind of sub-part of these questions. And then we also suggest some research and learning activities and methods that we think we can use as a field to answer those questions. So the first area is prevention, and this is kind of the most fleshed out area to date. One of the most popular interventions, as you probably know, prevention is the most popular kind of prevention kind of interventions in this field already, and large-scale awareness campaigns have been really widely used so far. And so we know that those are the most well-funded, but what we have found so far is that while there are short-term effects that we can see on attitudes and knowledge from these kinds of interventions, they don't really persist over the long term. And so, what we're, again, continuing to study, but what we're seeing so far is that information interventions and things that provide specific knowledge at the time that it's needed, and things that can influence behavior that are actually modifiable, have had much more success than these kind of large scale awareness campaigns. And then there's also kind of an assumption that improved social programs or social safety nets can promote individual resilience and reduce risk of trafficking, but it's kind of an area that does need further study. Under protection, what we mostly have found is actually research around the interventions for returned child soldiers. So that's a very kind of narrow and specific subgroup within what we tend to look at for human trafficking interventions and protection support. But we have seen some promising interventions with trauma-focused therapy. You can see those here, mainly in Africa and Asia. And then there was a small study, we're not sure if it's fully powered, so we'd like to see maybe more replication of this study, but a study that looked at an evaluation of emergency department providers, and it found that an educational presentation did increase the recognition of victims and the knowledge of resources, such as who to call if they did encounter a potential victim. But again, it was a smaller study, so we'd like to see more on that. And then in addition to kind of what we've seen with human trafficking, I just wanted to mention there are some promising things with human trafficking adjacent research. So while we don't know that much specifically on human trafficking, there's a really large and robust evidence base around financial inclusion, mobile money, and especially the graduation approach. So cash transfers and training and support for people who are in vulnerable positions, and that has really been shown to be effective to support them. And so we're hoping to see some future studies that use these models with human trafficking, with people with lived experience and survivors of trafficking. So with law enforcement and prosecution, I think we're kind of working our way from the most studied and more robust to the least. And so there's actually very few RCTs, only one that we were able to find that specifically focuses on law enforcement in human trafficking. But there was this one study in Nepal that showed that it was easier for police trainings to increase the knowledge of penalties on trafficking than on procedural knowledge. So how to handle suspects, how to recognize human trafficking, and that the trainings did lead to a greater appreciation of male victimhood and the risk of trafficking happening locally. But there was an inadvertent consequence that the more that people's misperceptions were addressed, the more that their beliefs increased that the victims were to blame because of their naivety. So we definitely would want to address that in any future research. And just generally with, there's a lot of trainings and capacity building of law enforcement and judicial officials, but we just want to, again, make sure that these programs are effective. All right, and finally, we can talk about the kind of partnership piece. This is focused on work in partnership with private sector, with governments, with NGOs and policymakers, especially around supply chains. There are no, again, that we have found, there are no studies focused on human trafficking in this space, but there are human trafficking adjacent impact evaluations. So there was one that had promising results from sanctions on conflict mineral zones in the Eastern DRC. And then HTRI is actually funding an ongoing study that should be wrapping up soon, where we're providing working capital loans or helping to support a program that's providing working capital loans for micro contractors to reduce labor trafficking in the construction sector in India. So we'll be very interested to see how that turns out. Okay, so all of that said, I think you saw some research questions from the RTA project, and we've talked about kind of learning questions from HTRI, but for us, we want to be very specific about what our experts are looking for we have an expert committee that we convene every time we have a funding round for the HTRI Competitive Research Fund. We've gone through about 5 rounds now, so we have a pretty good sense of what makes a strong proposal and a strong research program for human trafficking for us. And so here are some of the things that our committee would be looking for. And especially, again, this is kind of under the RCT framework, but I think maybe can be translated for all research, really. The first is that you really want a clear and concise research question. Again, for RCTs, for randomized control trials, we want to have a good understanding of what interventions do you expect to have what kind of result. So a really strong theory of change. And that needs to be targeted in what kind of form of trafficking you're looking at, what specified geography you're looking at, and again, and very limited in scope. It should be rooted in the academic literature. So you saw from this presentation, there's not that much that's specifically focused on human trafficking in the experimental research space, but there's again a rich body of qualitative research that you can use, or quasi-experimental research, and then human trafficking adjacent studies. So we definitely want to see, what are you building on to ask this question, and then how can this make a substantial contribution to the field? And the question should definitely be community and survivor informed. So if you're a researcher, you should have established linkages with local implementing organizations, and the research questions should definitely reflect the priorities of survivors of human trafficking. Research questions should be realistic and achievable. So can you answer the question with the budget that you have available to you? Can you do it in the time that the research study needs to take place? And then the final thing that we have is demonstrated policy impact. That's the last thing, but it actually is something that should be taken into account throughout the process. We want to make sure that whatever research is happening doesn't kind of just get published in a journal and then forgotten. We really want it to be usable by policymakers, implementable as quickly as possible by the organizations that are using these strategies to combat trafficking. So I think I will leave it there. So this is my email address. I'm always open to answering questions and talking to you. And then we'll also, again, I'll be sharing the research and learning agenda link in our chat. Thank you.
Wonderful. Thank you to our presenters. Now we have about 15 minutes left for some Q&A, and there are a few questions in the chat, the Q&A function. So what about the security and confidentiality of first responders like NGO staff who give support to victims of trafficking and frontline providers? And they're asking about security concerns and risks around their work and how you're safeguarding that.
With research, I think what we focus on really is the confidentiality and security of the researchers that are working with the survivors and respondents. And so I think when we think about, especially with impact evaluations with trafficking victims, we do think a lot about security of that, but we can also think about how can we interact and get this information from people who aren't in such a vulnerable position at the time. You know, if they're in an emergency situation, that may not be the best group of people to try to get information from to learn, because we don't want to have, we want to always have a do no harm approach to the research. We don't want to put people in a vulnerable and difficult position. So what we have advised, researchers and implementing organizations that are interested in studying this is to work with people who have already exited from their trafficking situation, and try to get information and to work with people who may not be in such an emergency, a difficult situation. As far as like good practices and working in emergency care and emergency context, I think there are definitely a lot of best practices and protocols that I could refer you to. But I think since we're focused on the research perspective right now, I would argue that we should either be working with people who have exited trafficking situations and examining that, or there are a lot of other ways to be looking at trafficking with supply chains, with with prosecutors, so we don't always have to go to people with lived experience first to answer questions. There are other pieces of the trafficking journey that we should be examining and trying to get there before we actually are working with people who, again, are in a vulnerable position.
Thank you, Jenny. I don't know if Lorenzo or Lauren, you have anything to add? If not, we can move on to the next question.
Let's move to the next question.
Wonderful. So the next question is, and I will pose this to you, Lorraine. How would you recommend an organization that wants to research any of these questions find a researcher to partner with?
Right, so I'm going to start and then I'll pass the mic to Lorenzo. So when it comes to finding a researcher, on the evidence gap map that we will publish by the end of July, you can also filter by the regions and also the countries. So the idea is that, like, when you filter, you can also see who are the researchers that are researching in your country. And from then you might get some suggestions on the researcher that you can partner with.
What we would like to do, this is what we learned during the process of building the research agenda, but also during the conference that we organized in collaboration with Jenny, with HTRI, and by contacting universities around the world that work on the issue of child labor, forced labor, and human trafficking. What we want to do is to build a community of practitioner, and this will be the place where maybe by exchanging idea and information, it could become a little bit more easy to find the right person or researcher or institution to partner with. But also by the consultation at country level with the academia and the policy actor, there we could understand also the different approach people from the academia use, the different need of the policy actor, and so the interest also from the people from the academic world, so that we could really see which are the researchers that are more interested, but also have the capacity to conduct a certain type of research. So we hope that through our network of experts to the advisory board, and especially the community of practitioners, we can give an help to those that would like to find the right researcher.
Wonderful. Thank you so much. Jenny, do you have anything to add to that?
No, I think maybe just one thing is that there are adjacent fields that are addressing similar issues. And so we have also encouraged people from implementing organizations to go reach out to people working in the humanitarian space, and again, survivor support in other areas such as intimate partner violence. So there's adjacent people, but I think that there is a need to bring more researchers generally into this field. So when people reach out, we do have difficulty sometimes matching implementing organizations with researchers. So I think all of us appreciate hearing from you because we do know generally who's out there, but we're trying to bring more people into this field.
Yeah, that's great. And I think that's something we've seen in recent years too. There's more and more of this effort on kind of collaboration across sectors, which is wonderful. Great. So now I'll pose the next question to Lorenzo and Lorraine. There are so many research questions. Which ones are the most important to answer first?
Is a question of prioritizing according to what are the needs of the country, if we are talking about a particular country. And again, our experience with this set of consultation is really to understand the needs of the policymaker. What do they need to know to do the right policy? And then also, if we look at the humanitarian sphere, what we need to know to act immediately. So I think this is what we need to ask ourselves, especially those working in the field, what you really need to know immediately to act immediately. And this should guide the research priority. And this information, I must say, should be public. We know that sharing information is difficult, but for the, if we talk about research, for the academia, it's also important to know which are the needs, which are the questions we should really give an answer as a matter of urgency. And maybe it's also our role to make this available to the world.
Thank you so much. The next question I'll pass on to Jenny. Would you say there's an ethical issue of using RCTs in the field of human trafficking? For example, maybe putting some people in the control group more at risk? If so, how is this being addressed?
Yeah, this is an issue that comes up a lot. And I think one of the main kind of things that we want to be thinking about when we're providing, I think this is most relevant to when we're providing services to people who have been trafficked. And so in the world that we live in, there's a limited amount of resources. There are a limited number of people that can get services at any one time. And so what we suggest and what we have seen happening in the studies that we're funding is a staggered approach. So if there were 700 people that might be getting support over a period of 3 years, you can delay the support for one group and have one group, a certain group go first in a certain geographic area, or randomize among different areas and have a group go first and then the next group gets the services. So there might be a delay in services, but there would be a delay anyway because we can't always give all the service to everyone at one time. So and there's another tactic where you're not actually withholding any services, but there's kind of a baseline of services that are being provided. And then, for example, there's one program that we're looking at where there's a mindfulness and kind of mind-body intervention that's being added on for some people. And so that's the part that's being randomized. So again, services aren't being withheld from anyone. We're not trying to harm anyone. Again, in this research, we're trying to find ways where we can ethically build on what is already happening, the services that are being provided, and then try to test different parts of those services to see what are the most impactful, what are the most effective. And again, also looking at the cost effectiveness of some interventions. Some are very cost and staff heavy and resource heavy, and some are less. And so if there's a lighter touch that you can be providing, and that saves more money so that you can reach more people, again, that's something that would be good to know.
Wonderful. Thank you so much. Yeah, I think that's very important, especially when we're living in a world of constrained funds. So trying to figure out what works best. Great. So the next question I will pass on to Lorraine. So trafficking in persons is such a complex phenomenon, and it involves kind of complex relationships even with the perpetrator. And the question is asking, why do we have to limit the scope of the research objective, I guess, around perpetrators? I don't know, Felix, if that is added that as the question. I'm having some trouble kind of deciphering it, but let me know if I got it wrong.
Yeah, no problem. I think when it comes to limiting the scope of research objectives, I think it's really about having something focused as well as prioritizing resources, right? Like this is an area that we identified through our literature review that there's not a lot of studies on. And through our discussions with the International Advisory Board, it is an area that we should know more about. So this is just one of the suggested areas, and perhaps we can do more work on so that we know how to inform policy actions over.
Great, thank you so much. And I'll now pass that question on to Jenny. This is a good one for you. So for capturing effective interventions, do you have a sense as to why this is a gap? Is it because evaluations of programmatic impact is harder to achieve? Or is it more that we need to better engage NGOs and CSOs working in the field of human trafficking to capture their good practices?
Yes, I believe there is, there's a gap between, I think this points to the gap between NGO, CSO work and researchers. And again, specifically with randomized control trials, there's a need for kind of large populations to work with. And a lot of what we've done to date in human trafficking interventions has been very person specific or small. You know, there might be a shelter that's providing services for 10 people. You know, so some of these things, the direct interventions, direct support services can be really hard to build up so that you can really look at an evaluation in, you know, the way that we need to. So I do think that there's a way to engage NGOs and CSOs, and a lot of the hesitations, I think, do, even with the NGOs who are working with larger populations and can study their interventions, I think there's a hesitancy to engage in impact evaluation specifically because of the ethics questions. And so I think that there's a kind of a training and awareness that we need to be providing to NGOs and CSOs. And then there's kind of a resources issue where a lot of these organizations are, you know, working the best that they can with the M&E staff they have. They may not have researchers on staff. And so having that extra time to take part in a research study, you know, it's not, it does take some extra resources. It does take some time. And so I think making sure that there's availability of resources for CSOs who are doing the interventions to make that available, and then helping them to create those relationships with researchers and to really understand how research happens and why a plan needs to be established and why kind of the plan needs to be followed throughout. You know, this could be a multi-year process. And that can be difficult for NGOs too, who want to be responsive to things, the changing needs on the ground. And so there's a lot of just kind of communication that needs to happen. And we're again, that's something we're trying to work on. And there are definitely some people that are kind of buying into this model and hoping to help show their impact through using it.
So now I'll go back to a question around capacity building. And I'll punt this to Lorraine and Lorenzo. How can we better build the capacity of local researchers and take meaningful advantage of their expertise? And there was a second related question here. I'll just lump them together. Someone was asking, how can universities and other institutions get more involved and contribute to this work? So I think there's kind of a connection there. So if you want to take both those, that'd be great.
The first part of the question, we are developing an online training curricula on starting with child labor on forced labor. We have also some element of human trafficking thanks to the collaboration of the RTA project between ILO and IOM. And I would say that this is a massive open online course. The Coursera style will go live in a couple of weeks, at least the part of it for the moment. And there could be a way where a researcher can build their capacity, because it really will go from concept and definition, data collection, ethical guidance, and how to conduct the research and all the different methodologies that one can use according to the research question. And also, something that we are starting this more as ILO to work with the School of Statistics, so to improve also not only the capacity of the researcher, but also the capacity of those that from the school will go in the statistical offices. And the program that we started a few years ago, I would like to revamp, is working directly with university by providing a lecture, but also working with the students in producing research, so that we can also have young people joining the group of researchers that treat very difficult thematic. And we know, and Jenny also was saying before about how many RCT we have on human trafficking, how difficult it is also to research on this issue. And another example, maybe Lorraine, you can
I can
give.
provide, exactly. So actually, within the RTA project, we have given fellowship and SEEK grants before. And this is one of the very good examples that we're able to engage junior researchers as well as researchers with more experiences to work together on research and developing research papers. And the result of this is that last year we were organizing a conference, a 3-day global conference with HCRI, also with Jenny. And in that case, we were able to engage researchers from different disciplines as well. And I thought, let me pass the mic to Jenny, if you would like to also elaborate a little bit more on this.
Oh, thanks. I was hoping to, do you mind if I answer just a different question? Sorry, because I know we're running out of time. Casey, there was a question about GBV and the link to that.
Yep, that was the next one I was going to get to. Wonderful. So UN Women defines trafficking in persons as a form of gender-based violence. The field of gender-based violence has a long history of comprehensive evaluations, including RCTs. The participant was wondering if you came across any studies on GBV that also address some forms of trafficking and whether your work is also looking into linkages with gender-based violence.
IPA has an intimate partner violence initiative that is seeking to look at some of the best practices and different research questions and using RCTs around GBV and intimate partner violence. And so we haven't really dug into that part of the existing evidence base yet, but I'm working with that team right now to do that. So I guess for that question, I would say stay tuned, because I think our next iteration of the research and learning agenda will reflect those questions, and would love to discuss more with you if you're interested in that. Thank you.
Wonderful. Yeah. So much to learn there from RCTs too, and also kind of scale development, a lot of kind of validated surveys that we can take from those spaces too, which is really great. Really appreciate all the wonderful questions. I just want to thank our panelists and all the participants for attending. So just a quick kind of wrap up. So to close, again, thank you for taking the time today to participate in the second webinar in the series of Trafficking in Persons, Data and Research, and for your very active participation. Apologies we couldn't get to all the questions. I'd also like to thank our excellent speakers for their presentations and the additional materials provided to advance the discussion. All webinars and the session recordings will be available on the NOTS website. If you've opted out of registration, you will be able to access the recordings on the ICAT website. Last but not least, I would like to thank all ICAT members for promoting the webinar series, the UNODC ICAT Secretariat, and NOTS Tech team for their excellent support, and the two 2023 ICAT co-chairs for spearheading this initiative. Thank you and have a great evening, morning, day.